In emergencies where professional medical help is unavailable, your knowledge is vital. Learn 7 essential medical interventions for grid-down survival, including wound care and infection management without antibiotics. These skills are crucial when hospitals are overwhelmed or inaccessible, ensuring you can protect yourself and your community in critical situations. Medical self-reliance is crucial when systems are overwhelmed, as seen during COVID-19. Major arterial bleeding can lead to unconsciousness in under 5 minutes, faster than emergency response times. Supply chains fail quickly, with essentials disappearing in days. Your medical knowledge not only safeguards you, but also supports your community in times of crisis. In grid-down emergencies, the first 5 minutes are crucial for addressing severe bleeding, airway obstruction, and cardiac arrest. Within 24 hours, infection risks rise, necessitating proper wound care. By day 7, dehydration from illness can lead to organ failure. Over weeks, medication shortages exacerbate chronic conditions, requiring improvised treatments. Building an emergency medical kit is crucial. Start with essential medications like pain relievers, antihistamines, and antidiarrheals. Include wound care supplies such as bandages, antiseptic solutions, and suture kits. Equip your kit with tools like trauma shears, tourniquets, and splints. Regularly check expiration dates and ensure proper storage. Training is vital for using items like tourniquets effectively. Identify the bleeding source. Arterial bleeds pulse and are bright red. Venous bleeds flow steadily and are darker. Apply direct pressure with clean cloth or gauze, pressing firmly. Elevate the injured area above heart level to reduce blood flow. For severe limb bleeding, apply a tourniquet 2 to 3 inches above the wound, noting the time. Clean hands thoroughly with soap and water for 20 seconds, or use alcohol-based sanitizer. Irrigate wounds using clean water under pressure, employing an irrigation syringe or a makeshift device. Disinfect with antiseptic solutions or alternatives like diluted bleach or hydrogen peroxide. Dress with sterile dressing, change daily, and monitor for infection signs such as redness, swelling, or fever. The World Health Organization's oral rehydration solution is crucial for treating dehydration. Mix 1 liter of clean water with 1/2 teaspoon of salt and 6 teaspoons of sugar. Administer in small sips, aiming for 50-100 milliliters per kilogram of body weight over 4-6 hours. Continue until symptoms improve and urine is pale yellow. Willow bark, rich in salicin, offers aspirin-like relief for headaches and inflammation. Steep 1-2 teaspoons in hot water for 10 to 15 minutes. Ginger, with anti-inflammatory properties, alleviates nausea and arthritic pain. Brew as tea or chew raw. Lavender, known for reducing anxiety and insomnia, can be brewed or used aromatically. For improvised splinting, first assess the injury for deformity and swelling. Gather rigid supports like sticks or boards. Place padding between the limb and splint, then secure with bandages or cloth. Remember RICE, rest, ice, compress, elevate. Ensure the splint immobilizes joints without compromising circulation. Regularly check fingers or toes for color and sensation. Garlic, with its allicin compound, is a potent antimicrobial. Crush cloves, let sit, then apply to wounds or consume raw. Honey, especially raw, is effective for surface infections. Tea tree oil, a strong antiseptic, should be diluted before use. Turmeric, rich in curcumin, can be applied as a paste or consumed with black pepper for internal infections. In emergencies, perform cardiopulmonary resuscitation by pushing hard and fast at 100-120 compressions per minute, at least 2 inches deep for adults. Use a 30.2 compression to breath ratio. Ensure the scene is safe, check responsiveness, and begin cardiopulmonary resuscitation if the person isn't breathing. Continue until help arrives or you're unable to proceed. Any cardiopulmonary resuscitation is better than none. Boiling water is the most reliable purification method, requiring a rolling boil for at least 1 minute or 3 minutes above 6,500 feet. Chemical treatment involves using unscented bleach or iodine tablets. Solar disinfection uses ultraviolet radiation by exposing clear plastic bottles to sunlight for at least 6 hours. Each method has limitations, such as fuel requirements or pre-filtering needs. Respiratory infections present with cough, congestion, and fever. Treat with rest, hydration, and steam inhalation. Gastrointestinal illnesses cause vomiting and diarrhea. Use oral rehydration solutions and activated charcoal. For wound infections, Clean thoroughly and use natural antibacterials. Heat exhaustion requires rest in a cool place and hydration with electrolytes. Document symptoms for accurate treatment. Plantain leaves, when chewed into a poultice, reduce inflammation and promote healing for insect bites and minor wounds. Yarrow stops bleeding and fights infection. Use its flowers and leaves on wounds or as a fever-reducing tea. Chicory root serves as a coffee substitute with digestive benefits. Echinacea boosts immunity, and calendula flowers create an antimicrobial salve for skin conditions. Field sanitation is crucial to prevent disease outbreaks. Set up hand washing stations with suspended containers and use ash or sand as soap alternatives. Dig latrines 200 feet from water sources, covering waste with soil. Ensure food safety by cooking thoroughly and preserving without refrigeration. Maintain personal hygiene by establishing bathing areas and washing clothing regularly. Mental health is crucial in crisis situations, often affecting physical health and decision-making. Prioritize sleep to reduce stress and improve judgment. Recognize signs of trauma, anxiety, and depression. Establish regular check-ins and safe spaces for expression. Maintain routines for stability and foster community bonds for mutual support. Childbirth in emergencies requires meticulous preparation. Ensure a sterile environment by boiling water for instruments and hand washing. Have clean cloths, string, and sharp tools ready. Post-delivery, place the baby on the mother's chest. Clear the airway and dry thoroughly. Cut the umbilical cord after it stops pulsing. Monitor for placenta delivery and any complications. For a lost filling or crown, clean the area gently and use oil of cloves on cotton or sugar-free gum as a temporary filling. For severe toothache, rinse with warm salt water, apply clove oil, use willow bark tea, and apply a cold compress. If a tooth is knocked out, handle by the crown, rinse gently and reinsert or store in milk. In emergencies without professional care, meticulous documentation is vital. Maintain a medical journal for each individual, noting treatment outcomes, medications, dosages, symptoms, and vital signs. Record age, weight, allergies, and medical history. This detailed log aids in identifying patterns and tracking disease progression, offering invaluable insights if professional help becomes available. Pursue certification through Red Cross First Aid and Cardiopulmonary Resuscitation or Community Emergency Response Team programs for hands-on training and community connection. Build a robust medical library with essential books like Where There Is No Doctor. Regularly practice and share your skills to foster resilient communities capable of effective emergency response.